Hey everybody, I am Bon and Bao, and you are tuning into Positivity and Pivots, where we showcase incredible examples of business resilience during these times. This week we are covering the healthcare industry. But no matter where you're from or what industry you're in, we encourage you to submit your stories of positivity and pivots. A huge thank you, as always, to SAP and Quantum Metrics for partnering with us on this and helping us get the word out. The average consumer doesn't think about their healthcare until they're sick. But now our healthcare system, and every nation's healthcare heroes are on the minds of the entire world. We talk about them as front line, but today and every day, they are our lifeline. In fact, the entire healthcare ecosystem has risen to the challenge, tackling this problem that has never been seen before, improvising solutions that didn't exist, pushing the healthcare industry to its limits, and going beyond to fight COVID-19. Of all the industries that we have covered on Positivity and Pivots, healthcare is one of the very few industries that is actually expected to grow between now and 2022. In fact, healthcare is oddly unique in that way. For the last 50 years, it has never seen a year-on-year decline. And while this pandemic has exposed many of the inefficiencies in our current system, which in the US adds up to $750 billion of waste, it also highlights its ability to pivot like no other industry because life is on the line. I believe the result of this will be new models of innovation that ultimately lead to decreased cost and, more importantly, improved healthcare. I'm not going to sugarcoat this because we all know that it's an industry that has had its challenges. In 2010, the U.S. Affordable Care Act began to help the industry shift towards a more value-based care model, focusing on the quality of outcome rather than simply the delivery of service. COVID-19 has expedited that need for change and has shined a light on the new needs of the consumer. In fact, the consumer's demand for greater degree of transparency and choice will likely be the driving force behind a number of these innovations, resulting in new business models enabled by technology, the rise of telehealth and virtual care, new forms of in-home health, new payment models, and new ways to measure health outcomes. In general, an entirely new healthcare approach. All of this is happening in parallel to some of the biggest macro trends affecting healthcare, like genomic data, artificial intelligence, and machine learning. It is an industry that will continue to be in rapid change. If you think about it, ultimately this convergence between biology and technology will likely usher in some of the most important changes to how we think about care. After all, if we go back, all pandemics are the worst thing that has ever happened to a society, the worst thing that a society can face, but it brings out the best in humanity. At the dawn of World War I, we faced the worst of all of these. It came to be known as the Spanish flu because they were the first to identify it as an epidemic, even though it started elsewhere. The world was at war, and our leaders were focused on keeping up the morale of our troops. Ironically, as the outbreak began to spread, the first victims were our men and women in uniform. The unintended lack of transparency allowed this silent killer to spread. But we learned, and while we're not fighting a war on two fronts, we are still fighting for our lives. But the other thing we've learned from the turn of the century is that the brave men and women on that front line will find a way. Even under the dark cloud of war, the healthcare community found a way for the first time ever to collaborate globally during that time, and they reinvented themselves and changed modern healthcare. And I believe that's going to happen again. As scientists work towards a vaccine for the virus, I hope, and even more, I'm confident that the healthcare industry together will build its own resilience so that we can emerge stronger post-pandemic like we have in the past. From my heart, ladies and gentlemen, this is one of the more important shows that I have done. It means so much to me for so many reasons. So many people on this show are people who I respect, people who I look up to, people who I call my friends. Everyone's insights are amazing. There's the president of healthcare, and insurance companies, there's inventors, and there's a first responder who fought in a war previous to this and also continues to be at war with COVID. So with that, I welcome you to the healthcare episode, and I'd like to bring on our first guest. Oh, you jumped. Who's there? How are you, sir?
I'm well. How are you?
Good. I'm good. So why don't you take a moment and just tell us who you are and what you do?
Sure. My name is Uzair Rashid. I serve as a director of innovation at Blue Cross Blue Shield of Massachusetts, where I'm sort of hyper-focused on generating both incremental and around-the-bend blue sky innovations that align within the strategic imperatives of our organization and are aimed to delight our members and our consumers. As a tie-in to SAP, I work heavily with the New York Foundry at SAP I/O, where I'm a business mentor and certainly a huge fan of the work the team is doing at the Foundry in New York. Absolutely compelling. Leading up to Blue Cross, I was heading innovation and strategy efforts at CVS Health, specifically focused on post-merger integrations, patient care transformation, and reimagining the delivery of care. And prior to CVS, I've been a lifetime consultant. I was a managing principal at a large tech consulting firm within their healthcare solutions vertical. Early career, I ran a boutique tech consultancy group of my own. Outside of the administrative stuff, I'm an avid mountain biker, a coffee enthusiast, and I've sort of become an expert quarantiner as well. It's a real thing, I swear it.
Well, I think that we've all become expert quarantiners in many respects. We talked, and I thought there was a lot of fascinating ideas that you were kind of focused on in terms of the transformation of healthcare. But I also thought your insights in terms of teams and kind of what you've learned from running teams digitally and some of the thoughts you had on some of the challenges that people face, some of the mistakes that they make, and maybe a framework that they should look at. So, I was really compelled because we're all dealing with that. And I think it is the first time that we've ever had to do that at scale. Do you want to just share a little bit of that?
Yeah, it's a great call out. This is sort of one of those topics that transcends industries, but is incredibly relevant in healthcare. And sort of if we think about it, Zoom has become like a verb, right? Like I'm Zooming, let's Zoom together. And from a shared experience perspective, the human touch might have been something that's been sacrificed. So, leading within an innovation function is really analogous to my background in consulting in that at its core, it's an influence role. And then there are these intangibles that we may have taken for granted in our in-person interactions, like nonverbal cues, body language, like human connection where you walk into a boardroom and can sort of feel it in the air. I'm sorely missing that. And I may be old school or fatally idealistic or however you want to sort of frame it, but I like to shake hands. I'm a hugger when we have a win. And the sudden loss of these intangibles is certainly a shared experience I think we can all relate to. But in the interest of relevancy, I want to focus on the missteps we can avoid to reap the full benefits of being distributed or having remote teams, right? To level set, the benefits of being efficient remote team is clear. You have access to global talent. There's countless data points that show distributed teams are happier, they have less turnover, they might be more efficient. There's cost savings in terms of not having to manage a cumbersome office space. And then to add and put it into context of COVID-19, for many traditional or entrenched organizations, sending teams home in this new normal of distributed or completely remote workforces was a direct response to a national emergency and social distancing orders that prompted everyone to stay home, secondary to a looming pandemic around us, not due to an organizational design choice, right? So when your entire head office decamps to work from home, the hardest part to manage is the cultural shock. I've been in organizations in the past whose culture is completely hierarchical, that say, if the perception is if you're not here, then you're not working. So some, 5 key missteps I think people can sort of pivot into opportunities to absorb the full benefits of being distributed really are, right? The first misstep being not planning properly, right? So at Blue Cross, planning for distributed work was just gravity as the first step. We took into account infrastructure to support remote work, communication tools, and simple things like the ability to reset your password when you're not on like a corporate network, right? The second misstep sort of leads to a more ethereal question of the types of distancing that exist within remote collaboration. The first is physical distance, right? This is place, time, geography. Certainly, there's also operational distance, which is like your team size, your bandwidth, your skill level. And the third, as I see it, is affinity distance, which is your values, trust, and interdependency. So with that, the second common pitfall I see in creating efficient distributed teams is cultural, where management fails to prioritize affinity distance. So the best way for managers to drive team performance in this setting is by focusing on increasing value and trust. And the next 3 I'll sort of zip through because they're fairly straightforward. The third misstep is really not recognizing that working remote is actually a learned skill. And really, as management or leadership or as an organization, we need to provide encouragement and emotional support to people as they traverse this uncharted terrain. The fourth is not establishing communication norms and not setting clear expectations, right? Like when we went remote, my team, we set very clear, transparent, easy to understand norms of communicating. Here's your tool for video conferencing. This is the backup. We're hosting daily stand-ups. We're almost over communicating and attempting to be even more crystalline in expectations. And this has really proven to be a really successful measure that we took. And finally, and I might argue most importantly, is not giving remote workers the freedom to be creative. And so I think if we think of these 5 missteps as opportunities, we'll live in a world where we're absorbing all of these benefits of working remote and distributed.
It's interesting because I think that there's so many lessons in there, but I think for me, one of the big pieces is also it's a learned skill. It is a learned skill because I don't know anybody who is not already complaining that they work more now than they ever have before. That they wake up, there is no break, there is no commuting to work. You walk to the living room or wherever you work from, you get on Zoom and you're on Zoom from 8 to 8 at night. And that is your life. And your schedule is more packed than you've ever seen before. People are mad when you're 2 minutes late. And it is a learned skill. And I know, I'm usually 10. And so I think that we forgot that we didn't know how to do this. And so that we needed to have and we're going to still have to do that because we're still going to be in this situation for quite a long time, I think, or there is going to be working from home that's going to happen. So to come back around, I was talking about kind of the changes that happened just overnight to healthcare. Everything from learning how to create ventilators from different types of parts to, different methods of care so talk about from your point of view, what are the biggest changes in healthcare that you've seen in the last 2 months?
Yeah, it's a great question. If we focus on the last 2 months, I think it has changed in sort of 3 distinct ways. It's the perception, the adoption, and the engagement within healthcare. And I'll bring this back to some almost a history lesson. When I was working on a telehealth program in my previous life, talking several years ago, I recall sitting across from one of our medical directors as we were ramping up to launch a virtual care program. And she was furiously saying in hands in the air, this is not how healthcare is delivered. It's a risk. You consultants, we're not in the business to sell cold stoves, right? Fast forward to today, and greater than 50% of providers have adopted telehealth practices. The CMS has amended guidelines to treat telehealth as an in-person visit and to allow for reimbursement for telephone visits as well. In addition to that, there seem to be more relaxed regulations by the government, the AMA, to restrict state-specific boundaries in some cases of virtual care delivery. And even like, outside of the provider side, if you look at the payer end of the spectrum, there are drastic changes today. Like Blue Cross Blue Shield of Massachusetts, as an example, has processed more than 1 million telehealth claims in the last 9 weeks since changing its policy to expand coverage for telephone and virtual visits at no cost. That's significant. And if we compare that to February 2020, Blue Cross received approximately 200 telehealth claims per day. Today, our health plan is receiving more than 38,000 telehealth claims per day. So, Blue Cross is reimbursing telehealth services at the same rate as in-person visits. The volume is picking up, the cadence is picking up. People are, and it's certainly interesting to think, it's in a time where patients and consumers are increasingly anxious, increasingly confused on where to get access to care. So having a new modality that tackles, distance as a challenge for delivering high quality care has been compelling. And then you look at plans like Primera Blue Cross, they just launched a virtual primary care health plan with zero copays to focus on virtual primary care visits. So the perception now has changed from the dangers of telehealth to the need to provide care agnostic of location. And I think this is fueled by the advancement of technology platforms, is fueled by network capabilities increasing like broadband or 5G. It's propelled forward by advancements in provider capabilities and payer creativity. And certainly the tools to augment the experience, like the Title Cares of the world. So adoption trends have also pivoted. We noticed that patients that have had to forego or delay treatment for chronic illnesses due to COVID are utilizing things like continuous glucose monitors to manage their diabetes and also feed data to their provider's electronic health record system. Patients with cardiovascular issues are using health trackers or ECGs to transmit data in real time to their cardiologist for remote review. Orthopedic surgeons are validating symptoms and conditions remotely and having great results leveraging telemedicine for post-operative follow-ups. There will be, I think, stickiness here that will lead to longer-term engagement and value from these digital technologies and innovations that is certainly pervasive past COVID.
That's the question.
And I also believe engagement will continue to improve.
Go ahead.
Yeah, engagement, right? So I think it'll continue to improve, and I also predict that adherence as well, right? So there's aspects within healthcare that have innovated from like 0 to 100 in these categories. And I think primary care, dermatology, behavioral health, they were sort of the low-hanging fruit, right? Like today, behavioral health, there's greater than 25 days of a wait time or delta to get in to see a behavioral health specialist, be it remote or face-to-face. So telehealth is shifting the paradigm and removing the stigma as well to get these sort of conditions treated for and be more on demand. And then I also think there's conditions that, or areas within healthcare that are going to go 0 to 10 in the long term in terms of engagement and adoption. And that's practices like ortho or gastro, where these specialties certainly require higher touch interventions. But for pre and post visit, telehealth, I think, will continue to be utilized and will strengthen the ability for patients to first manage their own health, and second, to build a stronger trusting relationship with their health system.
So the last question, I'm going to take an audience question, just because I think it's right. I believe that telehealth is going to be the future. I believe that connected devices are going to be a part of that. Are the payers going to be prepared to pay for those devices? So one is the doctor changing to a video, but what about all the other components that are going to be required to do that? How are you guys changing to kind of meet those kind of demands?
Yeah, it's a good question. I think in general and at a high level, a payer's incentive, and I think as a human incentive within healthcare, we're delivering a service, and that is to keep people well and to keep them healthy. And so if there exists key technology enablers that a payer can support, I don't see why you wouldn't. I'll draw an analogy, right? Like United did a plan, and same with Aetna. Aetna's was called Attain, where they teamed up with Apple, and under Medicaid Advantage, they were giving health trackers or Apple Watches to patients to manage their activity levels in order to keep them healthy and to digitally and remotely monitor activity as well. So as I think about the future of care delivery and I think about the future of the insurance market, I certainly see that there's a symbiotic benefit for both the patient, the provider, and the payer in enabling technology to keep the patient healthy and certainly, help them on their path to staying healthy.
Well, it's interesting because when we sat down and talked, and I'm sure everybody on this live knows that when you're driving innovation, usually it's hard to get it over the finish line because people are, they're like, hey, we're good the way we're doing it. But the moment the world changes, the innovation guy is the most important person in the building. So, Uzair, thank you for being that guy, and thank you for driving kind of the future state. And we just look forward to all the work you're going to do. And I'm just excited that you were able to come on the show. Thank you so much.
Thank you, Bonin.
Thank you.
Appreciate it.
Okay. We're going to keep this moving. Ladies and gentlemen, I'm going to bring up a dear, dear friend, a former colleague, and a mentor, and somebody who I look up to, somebody who I moved to China for, and it wasn't too hard. She didn't really have to twist my arm. And just somebody who, when you look at what she's accomplished and what she's done, it's tremendous. But even more than that is her ability to read the future and know where the world is going, and then execute on that is beyond anything. I thought I was good, and then I have to run behind her. So let's everybody welcome Cindy Chen. Hey, Cindy, I call you Cindy. Tell us who you are.
Yeah, so first of all, Bonin, it's so nice to see you finally after so many years. I love your podcast. The name is Positivity. This is exactly what we need. So thank you for that. Who I am. I am actually your friend, first and foremost. I actually used to, you are way too kind. I used to work for Bonin. Bonin was my boss. Indeed, he moved to China for me. So thank you. From professional side, I am the GM president of consumer healthcare and wellness for RB. Most people probably don't know RB, but you definitely know our brands. So I run a business where it's OTC, right? So we have a Mucinex, Delsum, Cepacol, but we also have a sexual being, which is a Durex and KY. So really, really exciting portfolio. The company, RB is also a purpose-driven company, right? So, now more than ever, we feel that, the company, the purpose of the company, the healthcare, but also even hygiene side, we have Lysol. It is so critical, important when we are facing this crisis.
I think I told you the story. I woke up because we had done the travel episode, and I woke up and I thought, oh my God, because all it was is consumer confidence is like the biggest thing. And I said, you know what, Lysol should be the official solution for, hotels, and that'll help with consumer confidence. And then of course you had issued a press release even before I had woken up. And
next day, yeah.
You guys had the idea. I was late. So no, I agree. But talk a little bit. You said there are really three things that you guys are thinking about when you think about the next place to focus on health and consumer.
There are so many things, right, that we're thinking about, but specifically there are three key trends that we think that the COVID, there's one memes, I'm sure you have seen this, right? The memes that who's actually leading the digital transformation, right? Is that your CEO, CDO? It's actually COVID, right? So COVID, if you think about it, it's a digital reset to me is the number one paramount, the number one thing we are seeing. It's not about the digital transformation itself, because you and me know. So many years ago, we were working together, the digital transformation and Mondelez, right? So the COVID thing is just making it much, much faster. So I would actually cheesily call that the industry a revolution 4.0, right? What it means is that, the speed is so much faster. And underneath that, there are three layers. The first foremost is about, the commerce system. Most people would say, we shifted more to e-commerce, which I would say, no, especially after working in China for 2 years. I would say it's an ecosystem change, commerce ecosystem, which includes, typical digital, typical e-commerce. There's cross-border commerce. There's DTC. There's social commerce, right? If you think about it, one funny example is my dad, who's 78 years old. Now he even has a Douyin, which is a TikTok in China. Douyin account, right? So, and before he even doesn't know how to do text message. Now he suddenly has this Douyin TikTok account. So it's happening. It's so much faster. And then if you think about my sector, which is the healthcare sector, before COVID, about 11% penetration online. Now, I'm sure it's going to be over 20%. Before COVID, China was already 24%. So we're going to catch up with China. The second piece is what I call a digital engagement. And as you see, when we getting into the recession, which we will get into, and some people will say we're already in a recession, and most of, there are not most of people, I would say there's certain percent of people, they will go to private label because it's cheaper. So it is critical for the brands to build a loyalty, but also personalization. And the third piece is what I call, your previous guest was just talking about digital health. It is huge. It's going to get into digital health, telehealth. As a matter of fact, we see Google search for digital health or telehealth is actually 10 times. Actually, this morning, I had my first ever virtual consultation with my doctor. So it's happening. It's everywhere. As a consumer, it's happening. In our industry, it's happening. So those are three big trends, what I call a digital revolution or industrial revolution 4.0.
Right. It's interesting. So can we talk about China for a little bit?
Of course.
Right. So share, what are you seeing post this that we can learn? Because I want to have you back. I want to do a whole episode just on China. But what are you seeing post this in China that might be able to translate to here?
There's so many things happening in China, right? So we think about China, digital, they are much, much faster than the United States. And people say that the e-payment is 3 times the United States. And also 45% total the e-commerce sales is from China, right? So even in the country like China, they are already advanced. They still continue to accelerate this COVID, definitely accelerate e-commerce or digital or virtual side. They penetrate into the sectors which is typically needs high touch, physical touch. For instance, one of my friends is in real estate industry, and if you think about you buy a house, right, Baden, I know that you were looking, to buy a house in New York, and imagine that now you actually cannot go out. But at the same time, in China, in March, people do a virtual looking around the house seeing is 35 times of what happened before COVID, right? So it's happening. It's just a different way of doing that. And then, TikTok, continue to grow. TikTok, instead of, I don't know about the status, statistics in United States, but I know because I have lots of friends working in Douyin, they actually hired 1,000 more people to help TikTok, right? The growth is just crazy. So China continue to accelerate the digital. Right. The second piece is about people, particularly younger consumers, millennials, Gen Z. They actually now they are quoting that they start to save, right? So we always say Chinese people they are really a saving economy. It is not for the younger consumers. But after COVID, now you see savings start to go up. But they also claim that they're gonna save more. And connected with that is also self-care, right? Which is very, very good for our industry. They are coming back to the basic needs, which is the physical needs, the self-care, and super, super important. They are saying that the post-COVID is continuing the trend. And last but not least is that the more and more interdependence between private sector and the government. And China, obviously, is a communist party, and most of the time, the government is making all the decisions. But the private sector is actually becoming really big, right? If you think about Ali, you and me went to Ali so many times, right? Alibaba and Tencent, now they're so huge. They are actually playing a really active role in this, pandemic. and they are donating, they are helping the government. So the interdependence is tighter and tighter. Those are three things, the three major trends I have seen in China. Maybe
Right.
you have more trends.
No, it's interesting because we saw the same trend of a younger generation now saving because they knew a rainy day was around the corner, but they never experienced it. And now that they experience it, they don't want to be caught off guard. But I also think that the thing that was fascinating to me as I watched China was the rush back to consumerism and kind of purchasing in malls. And I just thought it was fascinating that, and I get it because there's so much pent up demand. So I just want to ask this question as it ties to your previous point, which is I do believe there's going to be value, there's going to be trade downs. Have you seen that start in China already?
I think China, I actually think it's so funny, right? So Chanel, they announced that they're going to increase their price by 10%, right? Guess what? The second day when the lockdown is opening, you see that the people line up outside of the Chanel store and just making sure that they actually purchase all these products before the 10%. And one of my friends, it's only one single example, is after lockdown, she went to Hermes bought 5 purses. So I think the confidence level in China is actually quite high. Most recent data, we saw that China, the people who think that the business will come back in the next 2 or 3 months' time and will return to pre-COVID level or even stronger than COVID level is about 50%. Right, so which is quite high. They just gone through the COVID, and they also well know that the second wave of COVID will probably come, but it's still the confidence level is quite higher. Much higher than a lot of other countries in the world.
Right. Okay. Last question, Cindy, and I'm so sorry because we could do this all night.
No worries.
So what changed for you as a leader, and how have you pivoted your leadership as a result? I'm always interested in this, and especially
there's so many things in my mind. You and me talking about that question. I would say that more than ever, right? So my narrative and the company's narrative is to be a helper. What I mean by that is be a helper, being empathetic, listening to people is important, but more important is action, right? So how do you actually put it into the action, really helping people is critical, right? So for instance, how do you hire more people? How do you, my company is actually in a pretty good financial situation, right? We'll continue to hire. So how do we continue to hire people and even individual? How can I use my social platform to connect people, helping them find the jobs? So to me, COVID made me think like lives are important. Livelihoods is equally important, right? So as a company, we're in this unique position that we can help save people's life. At the same time, we can help people from personally, but professionally, but also company-wise. We can help people to find that the livelihoods back. And last but not least, we cannot do it by alone, right? So yesterday at the summit on LinkedIn as well, what I'm saying that together we're stronger. Right, so forget the minority, forget the diversity inclusion. We're gonna stick together as a human race because in front of virus we're the same. The second piece is that we're gonna continue to have that interdependence. It's gonna be critical to go through that pandemic. So the government, the public sector, private sector, we're gonna get together. And last thing I want to say is the public announcement is that. As RB, as a company, we actually donated 32 million pounds to help with COVID. But at the same time, we also set up a website called COVID19facts.com because there are so much rumor around, and we want to make sure we burst all those rumors and we provide consumers the right information, the truthful information that they deserve.
Well, I'm glad that you brought that into light because I think that. So many companies are trying to figure out what to do. And I think to your earlier point, actually taking action is the most important thing. And shameless plug, you are somebody who, I'm saying my shameless plug is that you're somebody who I continue to look up to. And I'm just happy that we had a chance to have you on the show tonight. Thank you so much, Cindy.
Of course. Anything for you, Bon, and you're the best. I'm just so happy that I talked to you today.
Oh, come on. I'll see you.
In all seriously. Biden, I'm going to do a plug. Biden is probably the most innovative person that I ever met. And hand over my heart, it's not plug. It's truly, I'm just so happy that I'm back with you and talking.
Oh, that means so much. Likewise, Cindy. Thank you.
Okay, see you
I'll call
later.
you later. All right, bye, Cindy. Okay, we are coming down the back stretch. I'm excited about these last four conversations because one is structured around data, so we can actually see there's two companies that are actually focused on the data side of what's happening here in the healthcare system. And then the other two are very touching stories of A, what they go through on a daily basis, and B, a product that's been created to help solve some of the challenges that our frontline workers go through. And we're going to give some of those to the audience as well. So let's bring up Mayor. Hey,
Hi.
sir, how are you? Why don't you quickly tell us who you are and what you do?
I'm Mayur Saxena, the CEO of Droice Labs. Droice Labs is a healthcare technology company that is based on one core thesis that every patient is unique and deserves personalized care. So, in essence, we help providers, payers, life sciences, medical technology companies match patients, individual patients, to the right interventions. So, it could be therapies or treatments or care regimens. So, we are that intelligent setup that understands all the patient data, compares it to millions of events in the past, and helps these providers take the right decision for this individual sitting in front of them.
Right. So, I mean, your business is not pivoted extremely, but you've seen differences. So, what are the micro and macro trends that you've seen over the last 3 months?
We have not pivoted as such. In fact, if anything, this is like a confirmation of the mission that Rice Labs has. And what we have seen is that we started seeing this quite early on in the process, like right since January, this whole huge wave of disruption, not just in healthcare and overall. In healthcare, particularly, what we saw was that, first of all, it was a shock to the overall healthcare system, where not just healthcare stakeholders, but governments and then, like different, let's say, supply chains got completely disrupted. And immediately, like everybody was scrambling through to do their best. But even today, what we are observing is that it's a very, very, let's say, resource-starved setup even today, both from a people standpoint, from a resource, let's say, a physical, component standpoint. And I think things are getting better, but we still, in my opinion, are not through, and still hoping to, fight this as we move on.
When we talked, you brought up something that I thought was interesting. You said you're seeing one story in media and yet another. Talk a little bit about that.
I think like I completely understand the frustration and the sadness that everybody's going through while we are pretty much, literally locked down and sitting inside our homes, completely unnatural way of living. And there is this inherent optimism, right? That I think at a certain date, this will be over and we'll be all outside. This drug will magically start working for everyone. Unfortunately, that's not something that I believe in. When I speak this with an extensive career in healthcare and like looking at the treatments and look at global trends of this disease, what is more likely to happen is that different types of drugs, different types of care regimens will work for different subpopulations, right? So for you, for example, you might see that above a certain age bracket, hydroxychloroquine is working, let's say, right? But it won't be that hydroxychloroquine is that magic pill that will start working for everyone. So I think as we keep understanding this disease more and more, as we keep seeing these, what the nuances are more and more, we will find multiple small, let's say, interventions or combinatorial therapies that will help different types of people. And I think that is more likely to be the case, just like, in fact, in most diseases.
And what is the data? Is the data supporting that?
I think so, yeah. And at least what the data we are seeing is, first of all, to be very honest, like I don't think we even understand the full set of ramifications of what exactly the COVID-19 is doing, especially when in combination with other diseases. Like, for example, if a patient has heart failure and diabetes and hypertension and something else, and then when they have COVID-19, how will they will respond to it? Now, will they respond to, let's say, a certain drug or a combination of therapies or not? We don't know. And like, will geography play a role? Will other resources, like which exact strain they got affected, will play a role? I think we are still learning that, and the data is showing that. For example, when we saw patients in China or versus patients in Italy, very, very different manifestations, especially in certain age brackets and certain comorbidities, very different way of disease evolution, very different way of responding to the interventions and so on. So I don't think that there is any one clear, let's say, understanding that we have developed, apart from the fact that yes, this is very, very serious, and we will have to continue fighting this.
Oh, that's amazing. Mayor, thank you so much for all the work that you do. Thank you for joining us tonight. Again, I could talk about, because what I love about what you guys are doing is you're actually seeing the clinical trial data, so you're able to actually see. And I think one of the big pieces I took away from our conversation and your answer just now is that it's going to be combinations and it's not going to be a single silver bullet. But it is going to be, there will be solutions, and we're seeing that.
I think so. I think it's all on the right track. I think as long as scientific, rigor is followed and we continue to stay data informed, we will come out of this. And but as long as we all are diligent about it, and we should, as scientists, I think at least I would appeal to all the scientists to continue in that direction. And actually, there's a lot of faith restored, in how the whole community has come together. And I can only be thankful to be, contributing towards and benefiting from the efforts from all around.
Well, that collaboration is going to be key. Thank you so much. Have a fabulous night. Thank you for joining us.
Thank you, Bon, and take care. Bye.
Oh, my pleasure. Okay, we are going to bring up Kashal. Did I pronounce it right, or did I get it wrong?
It's so close, Kashal.
Oh my God! I thought so now we know how to pronounce your name. My apologies. I'm so sensitive because people screw up my name all the time. Tell us what you do.
Great. So I'm Kashal Rogers. I'm the founder of Time Study, and we offer an enterprise platform to healthcare systems. Our platform allows them to understand how practitioners spend their time at work, and most importantly, how that impacts the things that matter most in workforce effectiveness, operations, as well as compliance. We've been in market since 2017, and our goal is to take the data that's available regarding how you spend your time and to show how that impacts your satisfaction at work, your quality of work, but also the people that you serve.
What does the data show us?
So we already knew this before COVID. Physicians spend about 33% of their time with patients. After COVID, of course, everything's amplified. So there's even more administrative overhead, believe it or not. There are more patients, but there's also even more administrative overhead. And a lot of that drives burnout. So we're seeing more of the same behavior, just amplified.
Right. When we talked, you were sharing a lot about on the nurses side too, that you're seeing just increased administrative load, that must be something that's got to be ordering. Yeah, you want to talk about that a little bit?
One of the things you'll notice with the care team is, in COVID, there's the typical patient service, but there are also other things like more communication, because we are in a global pandemic. Someone has to communicate the rules that govern who can see patients or if they can see patients. There are more phone calls, as well as that there's a resource limitation. So finding protective equipment takes more time. If there's not enough PPE, physicians are actually looking independently for PPE. I've even seen tweets of them connecting with residents in their communities to pick up PPE. So all of that really drives that administrative overhead. In a crisis, it actually creates more, you have more risk, so there's more stress and there's more burnout.
Right. And so you guys have been around since 2017. So what has this done to your business?
So we were already on the track of looking at what we call top of license time. So that's the time that you actually spend doing what you were skilled to do. So for physicians, that's time actually spent with patients. So we were already on track with that. With COVID, we've amplified, or I should say we've escalated our roadmap, because mobility has become really important. Being able to collect the data that you need and get the communications that you need while people are on the go. So there's telehealth, there are people moving, there are patient operations to new centers. So during this time, we've actually created our mobile tools. We're offering real-time data collection. We're looking at ways to decrease the amount of time that our practitioners spend with with technology. So not only are we looking at how administrative time impacts the thing that matters, we're looking at how does your technology actually impact patient care. So are we actually driving up the administrative time by asking them to do more things? So a lot of that has come out of COVID. We've actually amplified a lot of those products.
So let me ask you this, just as a last question. How has it changed you as a leader?
I think it's changed a lot. I'm a technologist. My background is in computer science, and we talk a lot about automations and algorithms. The first thing we did when COVID hit was we took a look at our automations to make sure that they were not so brittle, that they were doing things that would cause the physician stress. So for example, our platform alerts and notifies people when they're not compliant with their data collection. So for me and my team, it makes us more human. The first thing we did was we thought, wait,
alerts.
we don't want to do is to email these people in the middle of a pandemic asking them to do things. So we've worked with our key stakeholders in our hospitals to actually fine-tune communications. But that requires having a platform and frameworks that are flexible enough to do that very quickly. And thankfully, we were already in place for that.
Right. Well, and personally, leading your team?
Personally, our team has, it's been rough. Our company is based in New York. So a lot of our teams are in really critically impacted areas. We're working remotely. On a personal level, I think for everyone, and not just for me, this has really clarified what matters. And, again, we were already on that track, but this really forces you to focus on the thing that matters. And if you're in technology, there's this tendency to over-engineer everything. There's this knee-jerk reaction that you have to just throw your technology at these problems. But for us, it actually caused us to step back a bit, to see where the technology sat in this complex environment and to start to peel away the things that don't matter as much. And for me, that's been the case in my life, but also in my work.
Well, thank you so much for doing what you do.
Thank you.
Thank you for joining us tonight as well. I'm going to bring up our next guest. I said this at the top, which is really, it's going to be the collaboration of the humans that are at the front line, both in the healthcare industry and actually serving patients. And we've seen that historically be the case. And I listened to an amazing podcast, which is on the Spanish flu. And I listened to what the doctors went through during that time period. And even though the tools were more primitive, the emotional, the mental, and just knowing that the work that you're doing is so important to humanity is the same. And I'm really excited to bring somebody who I went to college with and a friend of mine, Honest. So Honest, just tell us who you are, what you do.
Sure. Thanks, Bonin. So I'm an anesthesiologist. I'm also a pain management specialist. I've been providing anesthesia services for patients needing surgery, either elective surgery or emergent surgery. And also I've been working with patients who have acute or chronic pain, seeing in the hospital after surgery or in the pain clinic as a pain management specialist. I've been working in New York City for the last 12 years. At Columbia University Medical Center for a number of years, and then most recently at Montefiore Medical Center, where I was during the COVID surge.
So, we talked a lot, and it was so moving just to hear just the challenges and just tell us what's it like?
Well, I mean, right now things are much better. Things have kind of settled down. But back in on March and April, it was really something that no one could have imagined. We kind of kept track ever since things started in China and slowly moving in through Europe and Italy and Spain and finally coming to the US. The whole coronavirus kind of a transit, and then at some point we were basically like waiting for the wave to hit us, but no one really expected what it was going to be like when it did happen, and it was very hard mentally and emotionally and physically as well, just because nobody was really prepared for the whole enormous basically the surge that happened. But we just kind of did the best we could and stuck together and powered through it.
And we talked yesterday, and you were telling me that it was a weird feeling because you had to treat everybody as if they had the virus.
Yeah.
Because at any moment something can change. You don't know. So how do you get through like that mental and emotional and going to work and almost having that social distance without?
It's very hard. I mean, there's like so many things you worry about. Going to work, dealing with the enormous stress and the sick patients that you don't really know how they're going to end up, doing. Work with your colleagues. Just the fear, anxiety of getting sick or not knowing of being sick, and getting somebody close to you sick as well. But how do you deal with it? It's just you stick together, you talk to your teammates, you do a lot of group chats and, encourage, each other. At least on my end, I try to kind of keep up with all the information that I could really get my hands on, using a lot of social media and reading about it. So my knowledge, I was kind of really trying to expand it as we go, because there was a lot of, and still there's a lot of unknowns about the disease. And then most important of all is basically just trying to stay protected at all times. So early on, we were just testing people that had sick contacts or travel history, but there was a lot of asymptomatic patients around, so you have to be prepared. So nobody was really safe. At least that's how I looked at it.
You said that you were so far ahead of the CDC. You were like 2 weeks ahead. So any guidelines that came out were usually late based on what was happening, in real time. And then you said you spent, to your point earlier, social media chat rooms, and that it was really kind of the community of doctors that were. What was some of the innovations that came out of it? You talked about a few yesterday.
Well, I mean, there was a lot of innovative steps. Early on, I was really spending a lot of time on Twitter, basically following up with folks from Europe, Italian doctors and Spanish doctors, because they were hit really, really hard. So they were using a lot of information to convey to us. And one of the good things also what happened is that normally medical journals accept publications, but all the publications they were talking about COVID were basically published ahead of print and free for all. So you could look up information, months ahead. Then there was a lot of chat room, a lot of information, sharing information about how do you get appropriate PPE, personal protective equipment, how do you keep track, how do you maintain your masks, N95 masks, do you use UV lights? People started getting their all small portable UV basically bags to recycle their N95 masks. Then there was another innovation about using a so-called intubation box. So one of the dangers with COVID is during intubation, which is basically putting a breathing tube to the patient they're not doing well, there's a lot of potential of the virus spread to the providers around. So somebody came up with an idea to design a clear plexiglass or similar material light box that you can put on top of the patient, so it protects you from direct exposure. So that was kind of put into production, and we were getting these intubation boxes. Then on top of it, there was the face shields. There was a big thing as well. Besides having the goggles and the special masks, we also needed a lot of face shields, and it wasn't really easy to get a hold of it. So people started doing 3D printing of face shields and sending them out to the hospitals. So there was a lot of things like that that we had just kind of had to come up with as we went along.
Now, I talked about this earlier, but you have seen war, and as well as this. How do they compare?
So yeah, I was in Bosnia and Sarajevo during the war in the 90s, much younger back in the day, and I have to say, early on, I mean, I did kind of see some similarities. It's mostly about when place started shutting down with the lockdown, and you go outside, there's really nobody around. The fear, the anxiety, watching the news nonstop, not really knowing what's going to happen the next day, how it's going to hit you, going to work. I mean, only a few people obviously going to work, only essential workers, but going to work and kind of thinking about what's going to happen. Are you going to get it? Are you not going to get it? There were some similarities about that. Food. I mean, that also happened early on. Back in the day during the war in Bosnia, is that people just panicked and went and bought the food, and the stores were empty. So luckily we recovered from that fairly quickly. But those are some of the kind of similar things that I was thinking about.
I mean, can you draw? Were you able to draw on past experiences or muscle memory or?
I mean, a little bit. You can't really prepare for this. No one really has done this before. I mean, this is like a huge, kind of a huge event that you think about, you read about. There was a SARS, history from several years ago, but there was a lot less the impact compared to now. I mean, there's some muscle memory that we anesthesiologists and other doctors might have. We are prepared to deal with emergency situations, a lot of difficult cases, but something like this on an ongoing basis, day in and day out, I mean, not really. So you just have to kind of pick up and learn and go with it and roll with the punches and hope for the best.
And what's the future going to look like?
Well, the future, like, really nobody knows. There's like so many unknowns. As of now, at least in New York City and New York area, everything is still shut down in terms of elective surgeries and seeing doctors. There's a lot of telemedicine, as we talked about. So now we're trying to figure out what's a safe way to open up the hospital flow. We're using a lot more testing. We have to do a lot more vigilance, screening the patients. I don't think we're ever going to go back to the normal, kind of state of affairs until we come up with either a vaccine or some kind of effective treatment or something else happens. But we have to reintroduce the business at some point fairly soon, on a steady, safe rate.
Well, Anas, thank you for everything that you do, my friend. I'm happy to call you my friend, and I'm also happy that you're out there because I know you have a big heart and you're a really smart guy. You forgot to mention where you went to school for medicine, but it was a good place, guys. So I'll let
Thank you, Bob.
Thank you so much, Anas, and enjoy the rest of your night. Okay, we're going to close out with an innovation that I think when you talk about a pivot, this is probably one of the starkest pivots that we've seen on the show to date, and also a pivot that is saving or is potentially saving lives, and at least definitely providing a much necessary service for those that are actually on the front line. Cressa!
Yay!
How are you?
Hi! Thank you for having me.
Yeah. Oh, wow. Everybody's
That's my dog.
excited about this this live show.
Everyone's excited.
So tell us who you are and what you do.
Okay, my name is Cressa Peterson. I'm a mom, a grandmother, a serial entrepreneur, and turns out I am also an inventor of shower toga.
What is the shower toga? Other than what our viewers might think it is. What is a shower toga?
Well, this is a shower toga, okay? And it gets compact into this small little design here. Shower toga is a 5-ounce. I think it's a very kind of innovative product that I produced, or I invented it only for myself for after I did Spartan races. I'm an avid Spartan racer, and I made the product to fix a need for me. When I finished racing, I would be filthy and muddy and dirty and sweaty, and then I would drive home for hours to get to my place. And I made one out of diaper cover material from Walmart, and turns out it was something that everybody wanted to borrow at the race. I ended up getting a provisional patent, working on the permanent now. And shower toga, I had big dreams for shower toga. I wanted to go on Shark Tank. I ended up on Shark Tank and got a deal on one of Mark Cuban's portfolio companies. I'm incredibly proud to say. One thing I mentioned on Shark Tank was my passion and my dream for shower toga to become part of the disaster relief and for the homeless population. And lo and behold, I sure didn't expect that something like COVID would happen and it would fast forward my product into something that frontline workers all over the country have been using to clean up after their shifts before they go into their home. It actually allows you to shower anywhere. It's kind of like a 5-ounce portable locker room. After I was on The View, for example, in New York City, I literally finished filming on The View, walked into the middle of Times Square just to prove to everybody that you can undress and shower anywhere. In the middle of Times Square, took a water bottle, showered my entire body off, changed into my airport clothes, and got on the airplane.
Show us your product. Cressa,
You want me to actually do it?
Show us the product, Cressa. It's
Oh
a
my
very
gosh.
impressive demo.
Okay, so here's, I'm going to do it. No, hey,
All
look,
right.
I did it in Times Square. Why not, right? So you just take it, put it on over your clothes. For men, you wear it around your waist and you reach through. There's 2 side openings here. Okay, you reach through, you take off your pants, your underwear, everything. For women, all you're going to do is take it, run it up over your chest, remove your shirt, reach through these side panels again. It has like a welt pocket, so it's private and it won't gap. And you reach through, remove your pants. Now you can shower with any water source, your hose at your front deck. We've had people showering in the parking lots of the hospital. It's not a big deal. Once you do it once, you don't care. When you're all finished, you dry off with a towel the same way. Bring your towel under here, dry off your whole body. And you absolutely just reverse the entire process, and you're going to get dressed the exact same way you got undressed. Right over the top, drop it down, and then when you're finished, this shower toga turns into a bag. So you just tighten up this toggle, grab a handful, pick up your dirty clothes or your contaminated clothes, tighten up this other end, and you've got everything inside of here. When you get home, you can just drop it in the washing machine, and then you don't dry it. You just take it out when it's done and let it wick dry. It lasts for years, high quality, it's unisex, and it's turned out to be my dream of getting shower togas into the hands of people that it can actually help has been on a fast forward approach. So although that's not how I wanted my company to grow, I am very, very happy that it's helping people, and potentially, maybe, I don't know that it's saving a life, but it sure makes me feel good to think that maybe even just, it could save one person's life would be enough for me.
Well, Honest, we didn't get a chance to hear this part of his story, but he would say that about how he bought these thick rubber boots, how he was putting baggies over everything, how he was constantly worried he had to go in the basement to shower or disinfect the shower before he saw his kids. And so, what has the feedback been from some of the frontline workers?
Actually, the first couple of weeks, I couldn't go through the day without crying every day. I mean, it was just constant. I'm a crier anyway, but I would read these emails, and I'm going to get choked up now, but I would read these emails from healthcare providers that were just incredibly thankful, and they would tell me their stories. And it was, the feedback has been absolutely amazing. I just, I don't even feel worthy, but, they're the heroes. And just knowing that, I can be a little bit of a part in making them maybe worry a little less is just such a godsend. And I do have to say that, we also have been getting amazing feedback from the healthcare community in general. For example, we worked with, I worked with a board member on the Georgia Pandemic Board, and we sent them out to Kennestone Hospital to their ER staff. And just to make sure that, we're not a medical company. So we really wanted to make sure that we were as responsible as we could be in this time and really explain to people the process that they have to go through. And so I was just very thankful that I had so many people, like the Georgia Pandemic Board, like Kennestone Hospital, and some other facilities that have just been very, very aggressively wanting to help their people, and Mark Cuban, who has been, he's such an advocate for healthcare workers and the healthcare system in general. And my feedback has been overwhelming. I'm incredibly thankful, and I'm so thankful for them.
Well, Cressa, I know you are driving around in an RV, which you had planned to do before this all happened, and then the demand went up, and so you're now renting locker rooms or storage units so that you can keep the supplies, and you're keeping the journey going, and you're continuing to get these out to the people who need it most. I want to personally help. We want to personally help, so we want to give 20 away to anybody who's in the audience who has a friend or who themselves need one because they're a frontline worker, then just let us know. Feel free to text me. You can find my number anywhere, 646-759-1837, and we'll get that order out to you or a loved one or a friend or anybody who you know who needs one, quite frankly. Cressa, what you've done is amazing, and I think it truly speaks to what the point of the show is, really around positivity, but also around pivots that under these circumstances can transform a business and, quite frankly, transform society. And so with that, I want to thank you so much, and please, please, please keep doing what you're doing.
Thank you, Bonin.
Thank you, Cressa. Right. So everybody, thank you guys. I know we went over a little bit. Thank you guys for joining tonight. Again, I said that this was one of the most important ones to me. And it really touched me going through the pre-calls for all of these and hearing everybody's story. And you can see the lineup. We went all the way through from payers to patients to providers, and then the ecosystem in between, and individuals doing what they can to help the healthcare system and those that are part of it transform. And I really believe, and I listened to that podcast, and it's called, it's American Scandal, but there is a promo for that they just dropped in around pandemics, but it's an American Scandal podcast. You can see it. It's a pandemic, American Pandemic is the name of the episode. And in a strange turn of events, I listened to it last night. And as we were going through the upfront, I really wanted to get across one thing, which is it is going to be the human ingenuity and the people that, when put under pressure, are going to transform the industry that we, without sometimes the unsung heroes before this, the people that we don't think about on a continual basis until something like this happens, that are going to transform the industry that truly saves our lives. And so I'm just thankful for every single person who's doing that work. And I hope that all of us take a moment to thank them and are on the journey to help transform what I think is going to have lasting impact and ultimately change healthcare, at least for our foreseeable future. So thank you, everybody. Have a fabulous night. I'm Bonin Bao, and I am out.